Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Zahra Figueredo. How are you, doctor?
I'm very well, thank you, Louise. How are you today?
I can see you're connected to an IV over there. Are you all right?
Yes, I'm very fine. I'm actually doing a NAD IV, and I thought I would take advantage of the day and get in my IV, which I do quite regularly as I do with patients, and get a little energy boost. And we have a weekend coming up, so it's going to be a busy one. So I thought I would get going with an IV today.
In this case, what are you getting?
Good question. So it's a 500 ml IV with B vitamins, B complex, B12, of course, all the trace minerals, glutathione, NAD, as well as magnesium, calcium, vitamin C. So it's a very, very potent IV, and it lasts about 2 hours.
Wow, I'm glad you're okay. You're just doing it for keeping yourself in shape, I guess.
Yep. Walking the walk, as I like to say.
Okay.
Walking the talk, sorry.
We do have an interesting topic today, doctor. And I do have a few questions for you here. The topic today will be neuropathy and neuralgia. In this case, doctor, some people seem to use these terms, neuropathy and neuralgia, interchangeable. So I was wondering if they are different or is the same condition?
Yes, they are quite different. Neuropathy can cause neuralgia. Basically, neuropathy is a damage to the nerves. Okay, and then neuralgia is actually the pain caused by nerve damage. So neuralgia, algia meaning pain, is what the neuralgia is caused by damage to the nerve, and neuropathy is actual damage to the nerve.
Can you go a little bit deeper on neuropathy?
Yes, so there are several different types of nerves that can be damaged. And then, of course, various different reasons and causes for this nerve damage. So we have autonomic nerves, which are involuntary nerves, which control digestion, breathing, the beating of the heart, so on and so forth. And then we have also motor nerves, which are very common. Those have to do with our motor movement. So movement, voluntary movement of my hand, for instance, speaking, eating, walking. Those are the motor nerves. And then, as I mentioned, autonomic, which are involuntary, and then sensory nerves, which have to do with touch and feeling and so on and so forth.
How does it manifest? How do we know that we do have the condition, or the condition is starting, or
what kind of symptoms?
Yeah.
It can manifest in different forms. So pain, tingling, pins and needles, weakness or paresthesia. It takes on various sensitivity to touch, cold or heat intolerance, a little bit of irritability on the skin. So it can take the form of various different symptoms, and then depending on the nerves being affected. So as I mentioned earlier, it could be sensory, it could be motor or movement related, or the involuntary
movements that, yeah.
Exactly.
Is there any pain that we can feel when we suffer from this condition?
Yes. So it's usually a very stabbing, sharp pain. When we have neuralgia due to neuropathy, it can tend to be a sharp stabbing pain, burning sensations, pins and needles, again, sensitivity to touch and feel. So those are, and then of course weakness, weakness in the limbs or the areas in question.
Does this affect our balance?
It can definitely affect our gait, our balance, our movements, our walking. We can trip easily from neuralgia or neuropathy. We can lose our balance. We can uh, it can affect us in so many different ways. Again, involuntary movements and voluntary. So breathing, if breathing becomes difficult, also swallowing, chewing and swallowing, digestion issues, which we can't control. So that's part of the autonomic nervous system.
How does it affect the peripheral neuropathy?
Okay, so yes, so peripheral neuropathy is a type of neuropathy. Okay, it's a type of nerve damage, and it has to do with the periphery. So not the central nervous system, which entails the brain and the spinal cord, but it goes. So basically, the hierarchy is the brain, the central nervous system, brain, spinal cord, muscles, and those muscles, the motor nerves from the muscles. Okay, so that's sort of the hierarchy. And so when we're talking about peripheral neuropathy, it's usually in the lower um, part of that hierarchy. So the muscles, the anything that's outside of the central nervous system, basically. So usually the muscles, digestion, fingers, arms, legs, um, and so on and so forth. Then we have the motor nerves, which again are the for gross motor function, moving my arm, walking, talking, swallowing. Those are motor functions. And then we have again the autonomic, which is the involuntary movements like digestion and the organ function.
Doctor, is there any condition that caused this, the peripheral nervous damage?
Nerve damage, yes. Very, very commonly high blood sugar. So diabetes, very commonly, but diabetes
Both of them?
diabetes type 1 and 2.
Okay.
Type 1 tends to be better controlled because most people catch it early enough and they start on an insulin or the medication that's required to control the blood sugar. And so it seems to be much more common, a much more common occurrence in type 2 diabetes. However, it happens in both. And so blood sugar tends to be one of the biggest causes. And then we have trauma or nerve injury, direct trauma or accident or nerve injury or a surgery where they nicked a nerve and we have damage to a nerve. Or chemicals, chemotherapy, medications, antibiotics. Uh, what else can cause? Yes, so those are the typical causes and reasons for neuropathy or peripheral neuropathy and neuralgia. As well as nutritional deficiencies, especially the B vitamins. They can cause neuropathy and peripheral neuropathies and different neuropathies as well. Carpal tunnel syndrome, things like that as well. We're also toxins, heavy metals. These can all translate into a neuropathy as well. We have alcohol, heavy use of alcohol as well as autoimmune diseases, vasculitis, inflammatory diseases. These are all contributing factors to neuropathy and neuralgia.
Can this also develop because you have vascular disorders or infections?
Yes, absolutely. So, vascular disorders can result in a decrease in blood flow and circulation. So, absolutely, this can affect the way that the nerves are nourished and the way that the nerves function, and it can eventually affect conduction of the electricity down a nerve, as well as infections such as HIV, bacterial and viral infections, they can definitely all affect the nerves. A lot of viruses literally reside on nerves, so they can definitely affect conduction and pain and neuralgia, like shingles, post-herpetic pain, as well as a shingles pain. That can definitely affect the nerves.
So the $1 million question here, doctor, how these stem cells can help to treat this condition?
Okay, so stem cells, as I've mentioned many times in the past, stem cells have the ability to regenerate damaged tissue. So when we have damage to the nerves causing neuralgia, and we have peripheral neuropathy, we can basically undo the damage with the use of the stem cells and growth factors and the whole cocktails, all of the cocktails that we use, along with certain key factors in our diet that I always address in our very comprehensive approach. So basically, it comes down to increasing circulation and angiogenesis, creating the and supplying the tools and the building blocks necessary to repair the damage and reconstruct those nerves that have been damaged by either glycoproteins from high blood sugar or damage caused by a nicking of a knife in the OR, or whatever the case may be. So it's about going in and supplying the necessary tools and building blocks from the stem cells and growth factors, and the nutrients to increase the blood flow and increase regeneration of the nerves.
So in this case, doctor, what would be the method of deployment for the stem cells?
Yes. So number one would be local injection directly into the areas that are affected, right into the muscles, right into whatever local areas have been affected. In many cases, even this would be a good place to mention even erectile dysfunction, um, as well as erectile dysfunction, which can be affected by blood sugar. It can be affected by a prostate surgery gone wrong, or even gone right, but sometimes it's inevitable where you get nerve damage. So that's number one, as well as intravenous infusion of stem cells, as I am right now. These are not stem cells, but intravenous infusion of stem cells, absolutely, because it allows for the stem cells to go everywhere the blood flows. So with peripheral neuropathy, it can be so it's not necessarily local. It can be so diverse in the area that needs to be treated. So applying the stem cells into the blood is a no brainer. And then also we have the local, we have the systemic, which is through the blood, and then depending on where what else we may consider doing a intranasal aspiration and whatever else we may feel necessary. But those are the two biggest methods of deployment for peripheral neuropathy.
So by doing this treatment, you go beyond just treating this condition, right? That because this stem cell treatment will also cover some other issues that you may have.
That's right. So what we want to do is we want to, like I always say, we want to get to the root cause. We want to address the root cause of the problem. So if the problem is diabetes, if it's diabetes that caused the peripheral neuropathy, then of course we want to, if it's an autoimmune diabetes, which is type 1 diabetes mellitus, we will want to address the autoimmunity. We will want to, with the stem cells, so we want to stop those antibodies from attacking the pancreas, as well as to allow for blood sugar to be better regulated so we don't see further peripheral neuropathy down the road. So that comes down the higher, down the pathway. So that's number one. So we want to get to the root cause. So that was an example using diabetes, but let's say there's a toxicity or heavy metal toxicity or chemicals or a direct nerve injury. So we would want to address that by cleaning up the body, detoxification, perhaps chelation therapy to get rid of heavy metal poisoning, and so always approaching it in a way where we address the root cause, and so that we can hit the resulting effects of the cause of disease.
I always ask you, how long does this treatment last?
You mean in terms of once the patient comes
Yes.
to Guatemala? So this is a 7-day treatment. So on day one, we start with the detox, and then we continue with oxygen therapy, growth hormone therapy, age-appropriate growth hormone therapy, stem cell enhancement formula, as well as psychological and emotional balancing, which is really important as part of healing. And so this all lasts 7 days is what we need our patient to be in Guatemala for to complete the treatment.
All right, doctor. I don't know if I missed anything.
I think we've covered quite a bit today.
All right, doctor. I appreciate your time, and you have a wonderful evening.
Thank you. You too, Luis.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.